Hi, my name is Hillary and I am Dr. Karam's preoperative specialist here at the office. Today we are going to talk about everything surgery to get you prepared for your upcoming procedure. We're going to talk about preparations and then also what to do after surgery is over as well. So when you're done watching this video, you'll feel very comfortable moving forward with everything. And we're also very excited that you chose Dr. Karam. After you book your surgery with Dr. Karam, you will be receiving a package in the mail from us. It will have all of the vitamins that you need for surgery, and it will also have the pre and post-op guide that we will be going through today. If you need to reference anything that we talk about in the video today, you can always go through this guide that you will have at home. Now we are going to talk about preparing for surgery, so what you need to buy from the store before your surgical procedures. You will need to purchase Aquaphor from the store. You can find this at any drugstore, Walgreens, Rite Aid. It's a clear ointment. You will need to purchase Dial antibacterial soap. This is not Dial, but this is what it looks like. It's an orange bottle, and it's sometimes orange, sometimes blue, and it says Dial on the front. Super easy to find. You can also find it at any drugstore. You also need to purchase hydrogen peroxide from the store and some Q-tips. And if you are doing the fat transfer, you also need to get Spanx or just some tight leggings that you might have from working out. 2 weeks before your surgery, there are some things that you need to do to prepare. Number one, make sure you discontinue using anything except Tylenol for pain management, so no aspirin, none of that, just Tylenol. You have to make sure that you do not have any alcoholic beverages for 2 weeks before surgery, as well as 2 weeks after surgery. No smoking or vaping for 2 weeks before, and make sure that you discontinue using any of your vitamins that you normally take and start taking the vitamins that Dr. Karam has prepared for you 2 weeks before surgery as well, and we will be going through those vitamins in just a minute. The day before surgery, you are going to start taking an antibiotic. This is going to prevent there from being any infection after surgery. If you have a history of cold sores, you are going to take an antiviral the day before surgery as well. If you have any issues with blood pressure, Dr. Karam will put you on a low dose of blood pressure medication the week before surgery, and you will also continue it out after surgery as well. The night before surgery, you are going to wash your face, neck, hair, stomach and thighs with the Dial antibacterial soap. You only wash your stomach and thighs if you are getting the fat transfer. If you are just doing the vertical restore, you will wash your face, neck, and hair. And if you're only doing your eyes or the lip lift, you will only wash your face and neck.
That was good.
The morning of surgery is here, so exciting. So this is what you will do to prepare yourself for surgery in the morning. You will make sure that you do not eat or drink anything for 6 hours before surgery if you are going under IV sedation only. If you're going under general anesthesia, you have to make sure you do not eat or drink anything for 8 hours before. You are also going to repeat the cleansing that you did the night before. You're going to do the same exact thing the morning of. So exactly what I explained is exactly what you're going to do the morning of again. When you get out of the shower the morning of surgery, make sure that you do not blow dry your hair and make sure that you do not put on any lotion or any makeup for surgery. Dr. Karam has made an amazing protocol with vitamins for you to heal quickly after surgery, and we are going to go through them right now. So 2 weeks before surgery, you are going to start the protocol. All you're going to do 2 weeks before surgery is start taking your clinical support vitamins. So you will be receiving a morning formula vitamin and an evening formula vitamin. So you are going to take 3 of the morning formula vitamins with breakfast and then 3 of the evening formula vitamins with dinner. You start these 2 weeks before. 10 days before, you are going to add in the vitamin K. The vitamin K, you are going to take 10 pills 10 days before. I always recommend taking 5 with breakfast and 5 with dinner, or you could do 3 with breakfast, 3 with lunch, 4 with dinner. however you want to do it, so you split it up so you're not taking all 10 at once. And then 3 days before surgery, you are going to add in the last 2. We have bromelain. You're going to take 2 pills 3 times a day. We prefer you take this in between meals. And then you're going to take the arnica, 3 pills 3 times a day, and these will dissolve underneath your tongue. So you will not take any vitamins the day of surgery, and then the day after surgery, you will continue taking the vitamins, all of them except for vitamin K. That is only for before surgery, and then the rest of them, you will take them until the bottle runs out. And if you have any questions about what these vitamins are for, it is found in the pre and post-op packet that you will be getting in the mail. What to expect, surgical considerations. So we are going to talk about what you are going to expect when surgery is over. So I'm going to talk about a couple things. Not everything is going to apply to the procedure that you're getting, so I will explain exactly what procedure should be expecting what. So with everything that you get done with Dr. Karam, swelling and bruising is extremely normal. For every procedure, you will have a degree of swelling, and most people bruise. With the vitamins that Dr. Karam has provided, the bruising is very, very minimal. And if you do notice bruising, typically people have it around the eyes. Those tend to bruise more than the other areas. The swelling is going to happen no matter what. It's just part of the response from surgery. So I would expect that to go down in about a week. Pain, people do experience pain. You will have a little pain after surgery. With the fat transfer alone, typically people just take Tylenol for the first day or so. The pain is very minimal, if essentially non-existent, which is amazing. With the vertical restore, the pain will be moderate. Sometimes people don't really feel too much pain. Some people feel it moderately for the first day or 2. And most always with every procedure, you will go from taking your pain medication that we give you to just Tylenol. So some people don't even need to take their pain medication at all, and they just go to Tylenol for a couple of days, and then they don't have to take anything at all. To me, this procedure looks a little more painful than it actually is. So most people are surprised that when surgery is over, they actually really don't feel that much pain at all, and that's awesome. So that's sort of the pain situation. We do give you narcotic strength medication if you do need it for certain procedures. It's up to you to take it. You don't have to. And like I said, you can stick with Tylenol. There will be a degree of numbness as well included with the vertical restore. The numbness is usually just along the incision lines right here. It's just the sensory nerves, and everything always comes back. Usually about a month or 2, you'll start to get the feeling again. It's nothing creepy. Most people are totally fine with it. They don't even really realize it, and everything always goes back to normal after a little time. Bleeding. So with the fat transfer, there really isn't any bleeding. He harvests the fat from the thighs or the stomach area, and he injects it into the face. There's no suture on the face, so there really isn't much bleeding. With the vertical restore and with the eyes and with the lip, there is a little bleeding the first day when surgery is over. It dries up. There really isn't much of an issue with it, but you will have that for about 24 hours. After surgery is over, because you are under IV sedation and because you haven't eaten anything for 6 or 8 hours before surgery, depending on what you are doing, IV sedation versus general, there is a chance that you could feel a little bit nauseous. I always recommend to go ahead and eat something when surgery is over to replenish your body, as well as taking a Zofran. You will be prescribed Zofran, which is anti-nausea medication. So if you do find yourself feeling a little nauseous after surgery, which is completely normal, you can take a Zofran, which will completely get rid of the nausea. Also, something to know, when you do get a vertical restore or a vertical prevent, you will feel that your neck is pretty tight for a couple of days. So you will want to make sure that you have soft foods prepared. So protein smoothies, soups, anything that's softer, so you can make sure that you're eating enough and that it's not causing you any discomfort.
Make sure you're
Now we are going to talk about taking care of the vertical restore. So now we are going into complete post-op. I'm going to explain everything that you need to do after surgery is over. And we're so excited because the vertical restore or vertical prevent is Dr. Karam's very famous procedure, and we're so happy that you chose to get it with him. So, icing. If you do not get the fat transfer as well, then you can ice indefinitely. We always recommend frozen bag of peas, 20 minutes on, 20 minutes off. This is going to help bring down the swelling immensely, and it will also provide comfort for you. You are going to most likely have tiny little drains that will be coming out from behind the ear right here. They are going to look like this, and I will go through this with you in just a minute. So with these drains, you are going to get them taken out at day 5. They are placed there on each side of the ear on a little necklace that you'll be wearing attached to the necklace. These are here to help pull the fluid out from the neck to provide you with a pretty quick recovery. With the drains, you will notice that you will heal very quickly. All you do with the drain is you take it, you squeeze it shut, and you put the cap on. So when it's working properly, it's going to be flat like a pancake and not like this. You don't want it to look like this. So once or twice a day, you're going to pop the top off, drain it, put the cap back on, squeeze it, and it's just going to hang there. Super easy, kind of forget about them. You can tuck them into your shirt. You can shower with them. They really don't cause any issue, and you get them taken out at day 5. Now we're going to talk about incision care. So after the vertical restore is over, you can shower at 48 hours unless you get a laser or you get a peel. In that case, you have to wait 72 hours to shower. So at that 48-hour mark, this is what you're gonna do. You are going to get hydrogen peroxide. You are going to dip your Q-tips in the hydrogen peroxide, and you are going to clean along the incision lines right here, down in here, and then behind the ear. And you are going to do that 2 times a day with hydrogen peroxide. And then when you're done cleaning, you are going to get the Aquaphor that you purchased from the store. You are going to put it on your hand, clean hand, or you could get a tongue depressor, and you're going to put it all over the areas that you just cleaned along the incision line, and you do that 2 times a day. When you shower at 48 hours, after you take a shower, just make sure that you go ahead and you clean with the peroxide again. With the vertical restore, what happens is you come into the office for a 1-day post-op. We will take off the dressing that you will leave with. We will clean everything for you, and then we will re-wrap your head. And then you'll go home, you'll rest again, you won't do anything. And then the next day, when you get to the 48-hour mark, you will go ahead and take the dressing off, and then you will start taking care of everything yourself. Then you will come in for your 5-day post-op. At that point, we will go ahead, take the drains out, we will clean everything, and then you'll go home. After you get your drains out, you cannot take a shower for 48 hours. Because when we do remove the drain, there is a tiny little hole right here that we will cover with Aquaphor. We can't have any water or any soap get in that for 48 hours until it scabs. And then when you come in here for your 7-day post-op, we take out all of these vertical restore stitches, and then we clean it for you. Dr. Karam sees you, and then you're good to go until your 1-month post-op. So now we are going to discuss how to take care of the fat transfer. First of all, the fat transfer is so phenomenal for so many reasons, but with post-op, it is essentially painless, which is nice. You are going to feel maybe a little swollen, a little sore, but post-op, it's extremely amazing. I mean, people don't even really have to take their pain medication. If they do, they're just sticking with Tylenol for a couple of days. So it's great. How to take care of it. So Dr. Karam will be harvesting fat from one of 3 areas, either the stomach, the inner thighs, or the outer thighs. Whichever area he chooses to harvest from, he will put a tiny little suture that will be taken out at day 7. So for post-op, there's not much to do. You don't have to clean anything a certain way. You don't have to really do much except wait 48 hours to take a shower. You will come in here for a 7-day post-op, either in person, or if you are coming from out of town and you want to get back home, we can put a dissolvable suture in one of those areas so you don't have to come in the office and you can just talk to Dr. Karam over FaceTime. Something super, super, super important to know with the fat transfer, you cannot ice longer than 48 hours. So within that 48-hour mark, you can use a frozen bag of peas. Make sure nothing is super, super cold. Like I would not use a frozen ice pack, just a big block of ice. And this is because when it gets too cold, it can actually disrupt the fat transfer process and kill the fat. So making sure that you do not ice for longer than 48 hours is extremely, extremely important with the fat transfer. Now we are going to discuss post-op for laser or the peel. So whichever one you and Dr. Karam chatted about and decided was best for you is what you're moving forward with, and you are going to have the most amazing results. It's an amazing add-on to surgery or a great standalone procedure to get done for a refresh. So there are a couple things that you need to purchase from the store. You need to make sure that you get vinegar, white vinegar, and you need to get distilled water. So what you're gonna do is make a mixture that is going to be used for your skin after surgery. So the mixture is going to be half a tablespoon of the white vinegar mixed in with 1 cup of distilled water. So you're gonna make that. I recommend getting a spray bottle from Amazon or from a drugstore and just making it in the spray bottle to use. So the first day when you get your laser done, you don't do any cleaning. All you do is cover your skin at all times with Aquaphor. You never want your skin to be dry, so just make sure that it's just constantly moist and covered with the Aquaphor. 24 hours after your surgery is over, you will start taking care of everything yourself. What you're gonna do is get the spray bottle. You are going to spray your face with the solution that we have created for you, and you will spray your face, and then you're gonna take the Aquaphor, cover your face with the Aquaphor. You do that 2 times a day, the first day. How to get the Aquaphor off when you have to spray it again is super easy. You are going to take a pad that we have provided for you. It's a little cotton square, drench it in the distilled water, and then go ahead and clean the face off with the pad. So at the 48-hour mark, you are going to do the exact same thing, except you are going to do it 4 times a day instead of 2 times a day. And you'll do that from the 48-hour mark until you get to day 9. And then at day 9, instead of the vinegar, you are going to start to use Cetaphil cleanser. So that's another thing you need to purchase. Cetaphil cleanser, you can find it at any drugstore, super easy to find. You'll wash your face with the Cetaphil cleanser, and then you'll cover your skin with the Aquaphor. So make sure you do that again 4 times a day. You only do that 1 day. And then you're going to move into the next day where you will go ahead and instead of the Aquaphor, you will use the Cetaphil lotion. So you are going to go with Cetaphil cleanser and then Cetaphil lotion and then zinc sunscreen as well, which we will be providing you at your 7-day post-op with us. This is a lot of information at once and it can seem a little confusing. So this is all included in the pre and post-op guide. Everything is written down in extreme detail. So if you need to reference it, you always can. Okay, now we are going to talk about discharge and post-op instructions after surgery's over. What you need to do is make sure that you sleep elevated on your back for at least the first couple of weeks. I know most people are not back sleepers, so it can be a little difficult. So I do recommend trying to practice for a couple weeks leading up to surgery, getting certain pillows if you want, just to make sure that you can sleep comfortably. So we recommend really making almost like a little fortress for yourself. You can stuff pillows underneath your arms. You can buy a body pillow. Some people even use an airplane pillow to provide them with some neck support, some lower neck support. So whatever works for you. Super important to sleep on your back though, and very important to sleep elevated. Another thing is exercise. I know this is huge for people, and I know it's a little bit of a bummer, but it's worth it in the end. You have to wait 1 month after surgery until you can start getting back into your normal exercise routine. but you can go on walks. I really would use use the word stroll. So you can go on like a light walk. We just don't want you to get your heart rate up. So you can start walking after, about a week or so, but make sure that you keep your heart rate low and you just go on a very slow walk if you do want to get just a little exercise. Another thing to discuss is hair color. So you cannot get your hair done for 1 month after the vertical restore or the brow lift. Anything else that's not involving your incisions being put in here, you can get your hair done. But if you do get the vertical restore or the brow lift, you have to wait 1 month after surgery to get your hair done. Thank you so much for taking the time out of your day to watch this video. I hope it helped a lot. Remember, we will be meeting in person or over the phone to go over all of this together, and I will be here to answer any questions that you have. And we are so excited for your upcoming procedure. We look forward to seeing you soon. Bye.